I am here with Dr. Lindy from Foot Specialists of Birmingham. Heel pain is one of the most common foot problems people deal with. And for many people, it can last for months, even years. Today, we're talking about one of the most common causes of heel pain, plantar fasciitis, and why it can be so difficult to get rid of. Dr. Lindy, to start, what exactly is plantar fasciitis?
Well, plantar fasciitis is a common condition we see. It's related to a ligament in the foot, specifically in the bottom of the foot. And this ligament attaches to the heel bone. And then it's very broad, very thick, and it courses forward throughout the foot and then attaches to the base of the toes. So if you think of the plantar fascial ligament as kind of a spring for your arch, if you will, it's the bottom structure of your foot. It helps to absorb the shock of the ground. It helps to stabilize our foot when we are getting ready to push off when we walk. So it gets a lot of stress, it gets a lot of torque, and then it gets irritated sometimes. Sometimes it can get irritated in the heel, sometimes it can get irritated in the arch, but it's a very, very strong structure. Rarely has a tear to it, but typically it can get inflamed and it causes chronic pain.
Why does heel pain feel worse in the mornings?
Well, what happens is it's related to blood flow, really. This ligament is normally, when it's in use, has a lot of blood flow that's moving through it. And when you get that nice warm blood flow moving through that ligament, it kind of loosens it up and you can go around throughout your day. You can have a little ache, but it can be managed. But typically what happens is when you get off of your feet and you sit down, and usually the longer you sit, the worse it can get. But you go to bed at night, you lay down, your brain says, we're not using this foot here. So it decreases the blood flow through that ligament. And then that ligament basically tightens up and you get up from a resting position and you step down. It hurts. You go hobbling around a little bit. And then, as you get moving on it some, that blood flow will start to increase to the area and then it can loosen up. So getting up from a resting position is kind of a typical problem with plantar fasciitis. When you get up, it can ache more. And then sometimes people can even do physical activities and not really have a problem through their day, but their biggest problem sometimes is just getting up from a resting position. Just depends on what progression and stage plantar fasciitis are in.
Dr. Lindy, why do so many people struggle with this for months and even years sometimes?
Well, the most important thing about plantar fasciitis is you got to have a good diagnosis. And so I see lots of people come from other places and they're always treated for plantar fasciitis, but there are other things that heel pain or arch pain can be. So it's really important that you get a good diagnosis up front. I think a lot of times when people have heel pain or arch pain or something called plantar fasciitis, that people just assume it's going to be plantar fasciitis and they start a treatment regimen and they're going through these regimens over and over and they're just not improving. So you really need to think that if you're not improving in some way, you have to rule out other things that it could be. Things like stress fractures, there can be a cyst, or there can be nerve entrapments. There are a host of other things that can be involved that are causing heel pain that people will call plantar fasciitis, but it's not really plantar fasciitis. So the first thing to do is get a good diagnosis. The second thing is it has to do with the time duration of this condition. I think there's really two stages of it. There's kind of an acute stage where people can have it flare up and it can be bothersome. But if you catch it early enough in the acute phase, it tends to be something you can resolve, in a fairly reasonable period of time. The problem is that once people have this for 6 months or greater, I consider it a chronic problem. And a lot of people are in this state. And essentially your body's not recognizing it as a problem anymore, and your own immune system is not really attacking it. And so us doctors are kind of left treating it from outside methods, whether it's support or medication or other treatment methods. So it's really important to get a good diagnosis It's important to know what stage a patient is at. It's also important to know what activities people are doing. Sometimes they're just given some medication and they're not altering activities, so it never has a chance to heal. So there are a host of things that can affect the duration and healing process.
Bonus question
Yeah.
over coffee.
Yeah.
What's your favorite type of shoes?
Oh, that's a loaded question. I'll be honest, I don't like to recommend a particular shoe.
Okay.
I like to recommend types of shoes.
Yeah.
So I like running shoes.
Okay.
But many people will ask me, what shoe should I get?
Mhm.
And I'm like, I don't want to tell you that, because what
Yeah.
works for me might not work for you. And so really, to me, it's a matter of comfort.
Okay.
And so it's really,
Not
but I
a,
like
not
Brooks.
a. You like Brooks?
I like
Okay.
Brooks. Me personally,
Yes.
I wear Brooks. I've worn Hoka's. I like Hoka's.
Me too.
Asics, I think, is
Yeah.
good. I
Yeah.
mean, we're in a time with the running shoe technology. It's really good.
Yeah.
And so I go to a lot of these sports medicine conferences, and
Oh.
we get the designers and the manufacturers of the shoes, and we go to their locations sometimes and see how
Really?
the corporations,
That's really
do their
cool.
thing. So it's pretty neat.
Yeah.
But there's a lot of good shoes out there. There's a lot of bad shoes out there.
Yeah.
So I just kind of direct people on certain circumstances of shoes.
Gotcha.
But right now I'm wearing Brooks.
I kind of cycle through Brooks on Cloud. Like, I think some I like better. My preference is Hoka.
Yeah,
But-
Hoka's are great shoes.
Yeah, I like
Yeah.
this. Okay, this one's a for real question. What's some of the biggest mistakes people make when they're treating heel pain?
I think a lot of it has to do with compliance or knowledge. I mean, it's really important with my patients that I educate them on what this is all about. There's a lot of dynamics to this problem, a lot of causes, but you need to do certain things in order to improve. And some of that is activity related. Some of that has to do with shoes or inserts in shoes. So plantar fasciitis is not all one thing. You need to evaluate what that is, where it's at, and then specify a treatment for what stage a patient is at or what level of plantar fasciitis they have.
So, why does stretching or rest alone often fail?
Well, it's interesting because people go on the internet and they see stretching. And so they see basically two things: stretching, and they see rolling their foot on a frozen bottle or something to that effect. And so, our society, I think, is always more is better. So when people see stretching, they see, oh, I got to stretch. So they start stretching and they stretch and they stretch and they stretch, and they're not getting better. But what you got to remember is this is a ligament. So ligaments hold bones to bones, right? So they're only going to stretch so much. There's a little elasticity to it, but they're only going to stretch so much. Muscles will stretch. So yeah, if you don't have a problem and you want to stretch a muscle, putting a little stress on that muscle is going to help it slowly over time. But when you have plantar fasciitis and you're stretching and doing it very aggressively, you can make your problem worse, actually. So people start stretching, they don't get better. They go, well, I'm not getting better. I must have to stretch some more, or I must be more aggressive in doing it. And they end up going down this rabbit hole where they're actually not helping themselves. They can hurt themselves a little bit. So it has to be done the right way, and that's part of the education process.
And what should people understand before they seek treatment?
Well, you want to be careful of chronic pain. Some people think they have plantar fasciitis and it's something different. You want to assess whether you had an injury. Did this start suddenly, gradually? What are the aspects of this? How much is it affecting your quality of life? Is it limiting your activities that you want to do? So those are factors that, usually if it's bad enough, the patient's going to present to our office, and then we can go from there.
One of the most common questions people have when they develop heel pain is, why did this happen to me?
Well, there's a lot of different reasons you can get plantar fasciitis. Some of them we don't know. Sometimes people just have it or get it. But I find that generally there's a number of different things that are involved. Um, it's March now, so we're coming into
Mhm.
spring, and I see it this time of year. This is a very common condition this time of year. People who have been inactive through the winter, all of a sudden it's warming up, and they decide they want to start going out and exercising. Some of them start a little bit too much, and they can pull things, not just the plantar fascia, but other things can happen as well. Um, but we'll see it when people just start aggressively exercising after a period of inactivity. Um, Sometimes it's shoes, sometimes improper shoes can aggravate the condition. Um, Sometimes it can be a rapid increase in weight. So sometimes pregnant women get this when they're gaining weight at a certain period of their pregnancy. Injuries, twist turns can aggravate it. Jump from a height sometimes. And then there are certain activities that can aggravate it. Where people who are working on hills, landscapers, people who play golf or walking hills,
Mhm.
soft ground can aggravate this condition. I get people who go to the beach and are walking the beach and their heel is sinking into the sand, and the mechanics are a little bit different. That can touch it off. And it's not unusual. People come back from Disney World and they end up with little aches and pains. So we see that as well.
Yeah, that makes sense. So no more barefoot running on the beach.